Welcome. I'm going to have Dashauna Franklin on with me. I'm going to interview her for on That's Camellia podcast. She has over a decade of experience. She has a passion of enhancing women's health and their metabolic wellness. She has a bachelor's degree in nursing from University of Louisiana at Monroe University and a master's of science in nursing from the University of Cincinnati. Her practice is rooted in holistic approach where she focuses on and addresses the underlying causes of health issues like weight gain, perimenopause, menopause, and PCOS. Now, Dashauna believes that their true wellness starts from within, and she's committed to helping her patients achieve their best health by optimizing hormonal balance and improving their metabolic health. She builds lasting relationships with all of her patients. I'm a witness to that. And at the heart of her practice, she allows a tailoring of treatments that truly transform her patient's life. So welcome back to That's Camellia podcast. I have the honor and the privilege of interviewing nurse practitioner and hormone specialist Dashauna Franklin. Now, we're going to share a little bit of our story of how we met, but meeting Dashauna has definitely changed my life in this season of my life. Dashauna has over a decade of experience. She has a deep compassion to enhance women's health and their metabolic wellness. She has a bachelor's degree from the University of Louisiana in Monroe and a master's of science in nursing from the University of Cincinnati. Her practice is rooted in a holistic approach where she focuses on addressing the underlying causes of health issues like weight gain, perimenopause, menopause, and PCOS. Now, Dashauna believes that the true wellness starts from within, and she's committed to helping her patients achieve their best health by optimizing their hormonal balance and improving their metabolic health. She builds lasting relationships with her patients, and at the heart of her practice, she allows the specific tailoring of treatments that truly transform her patient's life. All right. Welcome back to That's Camellia podcast. Oh my goodness. I have one of the women who have changed my life in this season, y'all. Dashauna Franklin, nurse practitioner and hormone specialist. Girl, I have been just bringing everybody on board and trying to bring awareness to this whole perimenopause season that I have been in. So I know my audience has gotten my viewpoint, but I would definitely like for you to share your viewpoint. Because when I met you, I knew I was a wreck. I was like, girl, I can't sleep. I mean, the one thing I remember you asking me. So which symptom do you want to address first? And that's what I can appreciate. Because you say, to me, what I heard was, how can I help you most? And that meant so much to me. So I was like, girl, so I had one of them double whammies. I can't sleep and it's hot flashes. So tell me what you
And it actually go hand in hand, believe it or not. It is. It's so typical. So that was a question that I wanted to ask you because everyone's journey looks so different. Mm-hmm. And for some women, they may not have hot flashes. Some women come to me and they have never had like a hot flash before. For some women, it's all of a sudden, they're having like really heavy periods that they've never had before. And it's causing distress because they're having accidents at work. Or like you, they're unable to sleep, so they're chronically fatigued. So it looks so different for everyone. And so that's why I presented that question to you, because I wanted to know, what does this journey look like for you? That gives me insight into the way that I can best serve you,
Yeah. Yeah, like this holistic approach, and I can appreciate that. It's for the women who I want it all taken away. It is definitely a journey. It is definitely a journey because it took me 2 years. It might be 3. My husband can probably pinpoint it better than me, but it took me a while before I came to the point where I was like, I just need some help. And I didn't realize I needed professional help until I met Dr. Mariah at a conference that we were at together. I mean, until I saw the symptoms on the screen for me. Like, yeah. Oh, yeah, that's me. That's me. Got that one too. Oh, my goodness. I have all these things on this list. What is this called? So, I mean, it's one thing you got to acknowledge it. Before you can acknowledge what's going on with your life, you got to name it. So what is this thing? Yeah. So helping me get a name to this thing actually helped me start tackling it. And you was like, okay, well, and that's what it was. If you said, okay, let's get your levels. And once we got our levels, you're like, so this is what we're going to do to help you. And it's a whole, I told my husband, I said, it's a whole new world.
It's a new world. You feel like a new woman. Well, honestly, so your journey, it mirrors the journey of so many other women, because a lot of women have no idea what's going on. They just know that they don't feel like themselves. Oftentimes, as it, continues to progress, they feel miserable. They don't know what to do about it. They typically don't know who to ask. And oftentimes, whenever they present to their primary care doctor, because typically if we have any concerns, that's the first place that we go. Well, if their doctor isn't trained specifically in the care of perimenopause and menopause, then oftentimes the symptoms are overlooked because they're not thinking about perimenopause and menopause, especially for those women who don't present with like the typical symptoms such as having hot flashes, you know. So if you're just like, oh, I'm unable to like recall certain things, or I'm losing my train of thought, or I'm not sleeping well at night, typically that workup is going to look very different. That provider, if they're not menopause trained, they're not going to initially think, okay, this woman is probably perimenopausal and let's take this avenue. They're going to go down a lot of different avenues, you know.
Right.
And so oftentimes it takes women seeing typically multiple providers because, for example, if you are having, let's say, brain fog, where you're having difficulty like recalling things and it's becoming very concerning, then for a lot of women that turns into referrals to a neurologist, working up for different types of scans. That was kind of like my mom's journey. And I was much younger then, and so I had no idea what was going on. She had no idea what was going on, and that's the journey of a lot of women. And so you have all of these unnecessary testing, and for the most part, everything kind of comes back normal, but you're still not getting any type of resolution for your symptoms.
Yeah, that is so good.
Yeah. And then so you go down this rabbit hole. So I think number one, it sounds like you had that aha moment when you were at that conference and through Mariah's presentation. So awareness is key, and I think we're at such a critical point in history, in women's health history, where women now are becoming increasingly aware because these conversations are being had, and they're not just being had like within our intimate groups of girlfriends. They're being had on like national levels and platforms. You have celebrities who are now speaking out about their journey and what it looks like and what it took for them to finally get a diagnosis, and you realize that to a certain extent, there's no, they're experiencing some of the same things that we're experiencing. You would think because, you know, they have this celebrity status and access to more resources that their journey may be different, but it's not. And it's simply because there's a lack of education. So I was able to identify the symptoms that you're having and provide a resolution or a treatment plan because I have this additional training to recognize that. And often that's something that we don't get in our traditional programs. When I went through my nurse practitioner program, we talk very little about like menopause. I had never heard the term perimenopause up until the time that I went to get like this additional training. And even OBGYNs, I go to these courses and I, you know, take all these classes to learn about hormone replacement therapy and perimenopause and just all the hormonal changes that occur in men and women. And it's filled with medical providers from all different walks. So you have family practice, primary care physicians, OBGYNs, nurse practitioners, and the OBGYNs, I feel like they struggle the most because what we learn almost goes against everything that they learned in their traditional practice, which is that hormones are bad, hormones cause cancer. You know, you can't introduce hormones to a woman after a certain age. And so it's really key that you find a provider who is trained specifically in the care of perimenopause, menopause, hormones, so that they can present to you, so that number one, they can recognize what's going on with you, and then number two, they can provide that adequate care that you need so that you can get resolution or improvement in your symptoms.
That is really good. Awareness definitely is key because, and you said some women go through multiple providers, you know, so if you go to a provider and they're not addressing at least the symptom or acknowledging it, I'm gonna go to somebody else. Because I'm not crazy. I know what's going on in this body, and it's not right.
Exactly.
And it's not okay.
It's not okay. It's not okay. And just think about it. Sometimes it's just like joint pain, you know? Yeah. And so you go to your primary care doctor, it's not resolving. What are they going to do? They're going to order x-rays, not resolving. It's going to escalate to an MRI. Okay, no improvement. Let's send you over to ortho. And so you see how easily, you know.
I went through that. Dashauna, I went through that. Joint pain in my knee. They referred me to an orthopedic. They checked on my knee, had a shot, had a cortisone. I mean, all that stuff.
Yeah. All the things.
I'm wasting way too much money and not getting anything resolved.
Yes, and that is so key. And that's a good point that you raised because, you know, one of the things right now with perimenopause and menopause and women's health, one of the barriers, honestly, to access is the financial aspect of it. Typically, women are having to seek, you know, providers like myself, you know, who I am trained, but because specifically some of the care that we do for menopause is still considered somewhat off-label, insurance a lot of times may not cover some of those services. So to actually get that care, sometimes it is a financial investment. But if you look at, like you said, all the time and the money that you spent going from this provider to that provider and co-pays and having to pay for unnecessary testing, you know, it's almost like it it kind of comes out to being about the same, you know.
Yeah, and you want to write it in the budget. You write it in the budget. It's just hands down. When it comes down to, you know, I've said that to so many people, you pay for what you want to pay for.
That's true.
So if you really want to get well, if you really want to figure it out, you really want to tackle this whole perimenopause journey or figure out what it even is, you're going to pay the money. It's not about money anymore. It's about quality of life.
That's so true. And it honestly, it costs because everything comes at a cost. And so suffering through, okay, what is the cost of that to you? It's costing you possibly relationships because you're irritable. You know, it's causing discord in, you know, marriages. You're more irritable and less patient with your children. It's costing you productivity at work because of the brain fog and not really being able to concentrate. You're chronically fatigued. I don't know about you, but when I'm exhausted, I can't get anything done. Like
I'm not going to get anything done.
I'm not at my best. Exactly. So it's costing you so much. It's literally costing you your health because we talk so much about the symptoms of perimenopause and menopause and the things that are uncomfortable, you know, as far as like the hot flashes and the joint pains and the really heavy periods. But estrogen is also a very anti-inflammatory hormone. So as it decreases, typically that's where the joint pain comes in. That's where the increased belly fat, the visceral fat. That's where women are starting to have higher levels of cholesterol or maybe even hypertension or elevated blood pressure that they never had before, but suddenly they enter into midlife, into their 40s and their 50s, and all these markers are going up. So now it's not just that you're uncomfortable, it is literally impacting your physical health. We talk so much about breast cancer and its effect on women, but the number one risk factor for women over 40 is cardiovascular disease. And yeah, it's so true. And it's related to that decrease of estrogen as they enter into menopause that increases your vascular risk factor. So that's increasing your risk for heart attacks and for strokes.
Wow.
Yeah.
That is something. I'm just thinking like, just the high blood pressure. Because some people, if you have high blood pressure in your family history, they just take it as, oh, my mom had it, my dad had it. Yeah. Okay, I got it. Well, maybe not. Maybe you have it because of something else. Not because family history. I mean, yeah, you might be prone to it, but if you don't have to have it, if it's something that you could do to, you know, ward it off or not have it at all, wouldn't you want to do it? Lord, today.
Yes,
that's good.
It's so true. And especially for those who are experiencing that change when it aligns within that perimenopause to menopausal phase in their lives, you know? So it's definitely a contributing factor, something to explore.
Yeah, and I want to go back to what you talked about with brain fog. You said that happened with your mom. I don't know how many times. You go in a room and you're like, what was I coming in here for? I heard mom. I just heard and seen my mom do it so many times. But if I asked my mom, did you ever go through this perimenopause? And did you ever have any symptoms? I don't know. I stopped my period at 50 and I didn't have nothing else. No, that's not possible. That's not possible. That's not possible. So just the simple fact of that brain fog, mental clarity, because you need to have clarity when you're doing your job, especially depending on the type of job you have.
Right, exactly. Well, honestly, any profession, it does not matter. If you are a cashier at Walmart, you need to have mental clarity to count change back to that customer. It doesn't matter what you do and what industry you're in. Like mentally, you need to have that clarity. So it impacts literally every aspect of our lives.
Yeah, and I want to also go back to what you said about the visceral fat. So that's the belly fat, right?
So visceral fat is the fat that accrues around your organs. It increases your cardiovascular risk factors. It's known as the really bad, like deadly fat. Now, belly fat is very common in perimenopause and menopause for a few different reasons. So during that time, during perimenopause, your estrogen levels are just all over the place. They can be really high, they can be low. There's just like that fluctuation. At the same time, your testosterone levels, because women don't realize that we produce testosterone as well, and it's a very important hormone, reproductive hormone in women. Your testosterone level is declining. Testosterone helps to build muscle. The more testosterone you have, it's going to help your body to build very lean muscle. The more muscle you have, that's going to increase your metabolism, basically. So you have in perimenopause and menopause where women are producing less testosterone, and so less muscle, and estrogen is kind of fluctuating. So that's where you're seeing that increase in belly fat, and everything that you tried before suddenly just doesn't work. Your insulin levels are going up. I see women all the time. They come in, I look at their labs. Typically, most primary care doctors will check whenever you go in for your annual physicals. They'll check a hemoglobin A1C and maybe like a fasting glucose to determine if you're pre-diabetic or diabetic, or if everything is in a normal range. A lot of them don't check necessarily a fasting insulin level, and so that's indicative of insulin resistance, which we see an uptick in women who are perimenopausal and menopausal. So the combination of all of those things that creates like that belly fat that we're unable to kind of get rid of because your estrogen levels are declining. Your testosterone levels are declining. It makes it so much harder to lose weight. You have less muscle, so your metabolism is on the decline as well. It's literally like the perfect storm.
And so many women are going through it.
So many women are going through it. Yes,
some people even going for the lipo to just cut it out. They be like, just cut it out and stuff. I was like, that's kind of extreme. What else can I do?
But the thing is, and in my practice, I treat women for hormonal imbalance. I also treat metabolic disorders, weight loss. Your hormones are really like your foundation. And so I teach women that if you think about your hormones, that's your foundation. Anything on top of that, like we're basically building. So for example, if a woman, chooses to have any type of surgery, for like belly fat or lipo or anything like that. Okay, yes, you're removing the fat, but if you're not treating the source and what's actually causing it, then it's going to come back. So you really have to look at your hormonal health as basically like the foundation to everything else that you're going to build on top of it.
So hormones is the foundation to women's health, actually.
Yes, and men, all of us.
Men too.
Yeah, but especially women because we have so many more hormones than men.
So fasting insulin level, that is what's being tested or being looked at when the labs are being drawn for when you're trying to figure out where you are in this stage of all things menopause.
So in my practice, I typically draw a very comprehensive hormone panel. So it includes a few things. It's going to include your thyroid function. And typically in like traditional medical practices, if you go to your primary care doctor, they're probably just going to draw a TSH that just kind of paints just a small portion of the picture. I collect a full hormone panel that tests like all of your thyroid hormones. So thyroid's going to be in there, your reproductive hormones, so your estradiol levels, your testosterone levels, your progesterone levels, those will all be on there. There's another lab that's your FSH and your LH. That's going to give feedback as far as to how your ovaries are functioning. So typically in women, if their FSH level is like very high, above a certain threshold, they haven't had a period, for 12 consecutive months, that's typically very indicative of them actually being in menopause. So that's that. There's a few others. I typically check a cholesterol level, a fasting insulin level. Your lipid panel actually can kind of tell the story as well, as far as if you possibly could have like insulin resistance whenever we're starting to see those early changes on that cholesterol test. And what else? Your A1C. I typically do a ferritin level because we know that menopause is we know it's going to occur. 100% of women are going to go through menopause, perimenopause. But I had a patient.
100% of women. 100%. 100%. You're not getting out of this. 100%.
You are not getting out of it. 100% will go through that change. But since there's more awareness about perimenopause and menopause, I had a lady to present, and her chief complaint was just fatigue. She was chronically tired all the time, and fatigue is a very vague symptom. It can really kind of manifest as any and everything. She had hormone replacement therapy before, and she relocated, and so that was kind of like a gap in care, and she was kind of coming back to the area. And so we tested her labs, and hormones, of course, she needed hormones, but her some of her, what do you call it? Her see, I'm having a moment, girl.
We all have them. We all have them. We all have them. 100%.
Yes, she was severely anemic. She was very anemic. And I'm like, okay, so we got to get you over to a hematologist too. So menopause, so it's good to have like just that good comprehensive workup because although we know that women are going to go through perimenopause and menopause, like you still want to rule out, is there possibly something else that could be going on as well?
That's good. That's good. That's a good claim. So where should a woman first tackle this? Well, where should they start? I know I told them just from my own journey, you need to go get tested as soon as possible. Don't waste 2-3 years of your life spending money and still being miserable and making your family miserable.
All right, that's all we have for part 1 of my interview with Dashauna Franklin, nurse practitioner and hormone specialist. Come back next week and get the second part. That's all we have for That's Camellia podcast. Until next time, be blessed.